Tell us more about Boulder Center for Orthopedics. How long has it been around?
The Bowman Center for Orthopedics has been around for about 50 years. And I think one of the best things about our practice is that we're full encompassing for orthopedics.
Let's deep dive into joint replacements and how have they changed over the last decade?
Joint replacement over the past 10 years has changed a little bit, but probably over the past 15 years has really changed a lot. A lot of that comes with techniques. We're much better with our techniques, much more muscle sparing or minimally invasive. We have now robotics. We have computer systems that help us do the surgery. Also, the implants that we use to do the hip and knee replacements have been designed differently so that they're now lasting much longer. We're not seeing the complications that we used to see. So these implants are just state of the art, and we're really honing in on the biomechanics of these implants.
And what is Mako-assisted robot technology?
Basically, it allows me to preemptively, before the surgery, come up with an idea of how to reconstruct your hip or your knee. We can also actually put those implants exactly where we want to put them to improve the longevity, also the function of the hip or the knee. So it really helps us to make the joint as functional and long-lasting as possible.
Because we live in Colorado, some of your knee replacement candidates, do you see more of them at a younger age because of all of the outdoor activities that we can take part in?
Yes, not only in Colorado, but also on a national level. We are seeing more younger patients that are coming in with worse knees because they are so active. They are skiing, they are hiking, they're biking, they're tearing their ACLs. Well, along with that comes cartilage damage, and then eventually that leads to end-stage arthritis. So I see 40-year-olds, sometimes even 30-year-olds that will have horrific arthritis at this point. But thankfully, with the newer technology, we don't have to doom them to say, you got to live with this until you're 60. We can give that life back to them at an earlier age, even though we may risk that they may wear at their joint at some point.
So doctor, what is the typical recovery after someone goes through a joint replacement surgery?
Certainly the first couple of days, it's going to be pretty painful. But as you start to recover more, things get substantially better. You can walk immediately after this surgery. So as soon as your legs wake up or where the anesthesia wears off, we get you walking. You can do stairs immediately after surgery. In fact, you can't leave the hospital or surgery center until you can go up and down stairs. By 2 to 3 weeks, you're feeling much better. You're starting to get off the pain medications, which is a big deal these days. And then by 6 weeks, you're feeling much better. So we're still doing the physical therapy usually, but you're really starting to do more at that point. And then by 3 months, it's like you're a new person.
All right. Thank you so much, Dr. Bowman.
You're welcome.
So doctor, tell us more about yourself and what you specialize in.
Yeah, sure thing. Did undergrad at the University of Nebraska, where I was actually a college gymnast. Then I went to University of Texas for medical school, University of Mississippi for residency. I went all the way to Los Angeles for sports medicine fellowship, and now I'm here in practice in Colorado.
Well, let's talk about rotator cuff injuries, and are these really common?
They are. There's sort of two different buckets of rotator cuff injuries. There's a traumatic rotator cuff, like, ow, I fell off my dirt bike or had a fall rock climbing, and then there's the sort of chronic degenerative rotator cuff tears. That's what we see a lot of. The traumatic ones don't really discriminate based on age. Anybody can fall, anybody can have an acute injury. But the more chronic wear and tear degenerative tears, usually that's a little bit of an older population. You just have some miles on your shoulder and your tendons sort of wear down over time.
Now, talk to us about injections and when those might be used.
Injections are a great adjunct to sort of precede surgical intervention in a lot of cases. So there's a wide range of injections, and something that we offer here that's special that not everywhere does is what's called orthobiologics. It's a really fancy term for basically using your own biology. You usually draw blood, and there's different factors inside of that blood that can help with tendon healing, joint regeneration, just kind of getting tissues back to normal.
Okay, a lot of people hear about ACL injuries. So what is an ACL, and how do you know if you've torn your ACL?
Yeah, great question. So the ACL stands for anterior cruciate ligament. It helps to connect your femur and your tibia, and it has two real functions. One is to prevent the tibia from moving forward, and one is to prevent the tibia from sort of pivoting on the femur. And so when you have an injury to the ACL, signs and symptoms would be a pop, oftentimes skiing here in Colorado, but a big painful pop, big swollen knee, you have trouble bearing weight on it. That would be something that would be suspicious for an ACL injury. Really the gold standard would be to get an MRI, and that can help diagnose. There's a lot of keys on physical exam that we can see, like, ooh, I'm a little bit concerned for your ACL based on that.
So doctor, if someone is looking for treatment and services, why should they come to Boulder Center for Orthopedics?
I think the people here are amazing. Everybody's so kind, from the front desk to the docs to the PAs to the surgical staff, you name it. But also we're a one-stop shop, which is really, really convenient. We have a wide variety of orthopedic specialties: spine, foot and ankle, sports, total joint replacements, hand, upper extremity, you name it. You can be seen by somebody here, whether it's a doc or one of the nurse practitioners. And we also have surgery centers at both of our facilities here in Broomfield and in Boulder. So the same location where you see us the first time, get your imaging, get worked up, you can also have your surgery. That's why I think we'd be a good place to come.
Boulder Center for Orthopedics and Spine proudly serves Boulder, Broomfield, and the Front Range, and are committed to developing treatment plans based on your individual needs.